All right, everybody. Thanks so much for joining us for the GABC webinar series for August. Today we are going to be talking about the importance of oral health in early childhood. And we're going to be talking with Dr. Julie McKee, who is the State Dental Director, and Lacey McNeary with Kentucky Youth Advocates. So with that, I will go ahead and turn it over to you guys to tell us a little bit more about how important oral health is.
Okay, this is Dr. Julie McKee, and I'm going to talk about baby teeth and why they're important now for the rest of our lives. And then Lacey's going to talk more about how we incorporate the importance of baby teeth or primary teeth or deciduous teeth or whatever you want to call them into our outreaches in our everyday life in focusing on early childhood and early childhood programs. I'm going to talk about baby teeth, and I'm going to talk about adult teeth, kind of in general. Those are our objectives. So it's going to be an easy afternoon for you. We're going to talk about what dentures mean to us. We're going to talk a little bit about oral attitudes and values that are nothing but cultural in our state that gives us more dentures than we need to have in Kentucky. The life cycle of the mouth is, in reverse order, is death, dentures, adult teeth, and baby teeth. Death. That's when you can stop flossing. Not until then. You start flossing from the time you start getting those baby molars until the day before your funeral. Kentucky's over 65 years old don't like to keep their teeth. That's a national statistic that I'm not really proud of. We're the third worst in the nation for total toothlessness. Why is it important to know when we're discussing this and we're talking about very young children, you ask? It takes our whole life to lose this many teeth, and we need to stop it. Dentures. Dentures are an expected part of our life. I have adults ask me all the time, when do I start losing my teeth? And I say, oh, at about 5.5 or 6 years old. And they're like, no, really, when do I start losing my teeth? They think, and it is a cultural acceptance, that tooth loss is a expected and normal part of the aging process, and it's not. We love dentures because we don't have any teeth, so we replace the missing teeth with dentures. Dentures reduce our chewing capacity by at least 70%, and a lot of times we have some bone involvement that makes it a reduction by 90%. So you're sitting there thinking, why is this important to know when we're supposed to be talking about very young children? Once again, for the same reason. It takes all our lives to lose this many teeth. Adult teeth. There's a reason we have pronounced toothlessness in our Kentucky elderly because we use those years between 18 and 64 to lose our teeth. Kentucky has more teeth missing in our working population than almost every other state. It's because we think teeth in general are optional. So you're sitting there thinking, I signed up because I'm part of an early childhood council. I signed up to work with very young children. Why are we talking about this now? Keeping our adult teeth starts with keeping our baby teeth. That's one of the take-home messages of today. So, why do we have teeth? Why do we have a teeth as adults? We have them for a bunch of reasons. We have them to function. And function just isn't to bite into the apple. It is part of the eating process to chew up our food, so easier digestion. I would hate to digest a whole unchewed piece of ice or popcorn or something like that. So eating is important. The mastication, chewing it up, the mechanical breakdown of the food in our mouth, it's also very, very important in digestion. We forget about the importance of saliva in the actual digestion process. By breaking it down mechanically with our teeth, we also have the opportunity to knead in the amylase that actually is a huge breakdown of carbohydrates to get it to our tummy for further digestion and absorption. We have to have teeth to talk. You can find that out with two different types of people you run into in your day. Those with no teeth at all have a difficult time enunciating, and those children that are lost their first teeth, or actually their front two teeth, they have nothing to place that tongue against so that they can speak clearly. So it's important in speaking. It's important with communication with others, just not in speaking. We smile with our mouths. We frown with our mouths. We screw up our mouths when we find something disgusting. So it's our mouths, therefore our teeth are part of our communication. And also our other social interactions. We kind of look at people weird when they don't have teeth, or they've got weird teeth or half teeth or whatever. So there's a lot of social acceptance that comes into what our mouths look like. Our adult mouths do have an impact on the body. Dr. C. Everett Koop, who used to be he was the Surgeon General of the United States years ago, his quote I think is really good, and it's, "Do not consider yourself healthy unless you have a healthy mouth." Because he understood the incorporation of the mouth as the gateway to the body. If you have a sick mouth, don't think you're healthy. Also, one of the things that we recognize more and more as a population, and the medical providers are on board with this, is to recognize relationships with other body systems, that the mouth has either an indirect or a direct and impactful way to go with other diseases and systems we look at. We know for sure what the physiological links are between poor oral health and cardiovascular disease and stroke. And I kind of put those together even though they're two different disciplines because of what it does. This is really kind of a gross moment, but post-mortem autopsies reveal in the hard plaques of the aorta, as when we look at atherosclerosis, that bacteria can be cultured out from those plaques in the aorta that are found in the gums with gum disease. That really kind of grosses me out. Diabetes. There's a huge link between diabetes and our oral health status, and it comes in a bunch of different flavors. But one of the things that is clearly recognized is the definition. One of the main definitions of diabetic, it means reduced healing. It's not a pretty fact, but that's the way it is. So when we work with diabetics of all ages, including very young children, we want to make sure that they have no infection, that they have no disease in order to heal from. Pregnancy. There's a huge link between our oral status and our pregnancy. When we work with mommies, especially first-time mommies, and we get their mouth in great condition, we take care of the decay, we make their gums so healthy and leathery. I don't like leathery skin, but as a dentist, I pretty much like leathery gums. And we get them in great shape. Many things happen. The big things that happen is they will go fuller term, and they'll have a more normal weight baby. And these come into play with early childhood learning down the road. It's pretty magical, and I love talking about that. And I can talk for hours about that, but I won't. Obesity. We don't know as much about this direct link as we should, and studies are being done all the time because obesity is a problem in our country. So there's kind of think of that mentally as things to come. Cancer and other diseases. We know that there is a link between periodontal disease in middle-aged men and pancreatic cancer. We don't know what the causality is, but we know that there is a link. Also on the rise, even though it's a minor cancer in general, oral and pharyngeal cancers are on the increase in the United States, and they are tied to the HPV virus that seems to be pretty prevalent in our population as well. So, why are we even talking about this? We're supposed to be concerned with those very young children because our formative years are just that. We try to use our formative years for growth and development. We want to promote health, and we want to reduce or treat or eliminate sickness. Our formative years set up the footprint for the rest of our health status more than we'd like to think. One of the links that I can speak about with this is we have moms that feel just a little guilty on how their children's teeth look as far as decay. And they're like, well, you know what, I'll do better when their adult teeth come in. And the fact of the matter is, as unfortunately supported in studies, they don't. But if we can move them and other people that encounter children to prioritize oral health younger and younger and younger, it's just going to make better health status, both orally and in general health, down the road. Baby teeth. Why are they important? Because we're going to lose them anyway. They're just temporary. They have the same functions as adult teeth with the eating, the mastication, the child learning how to break down the food. Digestion is so important in growing bodies. Speaking and communication with others and social interaction, that is huge with children because they're learning how to speak. They're learning how to say their V's as in victory rather than F's as in Frankfurters. They're learning the difference between making a B sound and a P sound, and you've got to have teeth to do that. Teeth are very important with their communication with others. Children of any age are they notice things that are different and weird, and it's important for children to have oral health, not only to be able to learn, but to be more socially interactive and confident in approaching people to communicate with them. Okay, but here's another reason that teeth are very, very special. The baby teeth are very, very special. They hold the space for the adult teeth. That's one thing we all temporarily forget for a while. But they do have functions in eating and interacting. But one of their major deals is they hold the space for the adult teeth. The adult teeth aren't going to get there for a while, so they need to do that. And our adult teeth start erupting into our mouths at about age 5.5 and don't quit in some children until they're almost 13. So that's a big space of time that we need to maintain space. Here's an idea. I've got a couple of slides just so you can appreciate premature tooth loss. These are actually the bottom 4 teeth are incisors, and those are actually adult teeth. But the other teeth you see going toward the back of the mouth, those are baby teeth. Now, don't get me wrong, they're pretty darn beautiful baby teeth. But for some reason, this child had a premature tooth loss of the baby canine or baby eye teeth on the lower arch. Well, the adult eye teeth are really, really big. In fact, they're the longest teeth in the mouth. And there is no room for them because you can see how that space is closing up. Here is a cross-section of what that looks like. And I hope this doesn't gross you out too much. But what it is showing teeth in the gums. It's showing eruption. And what this shows is, see the big arrow? That is pointing over a 6-year molar. And what's happened in this particular mouth is this child lost their second baby molar way too quickly. The 6-year molar, the first molar there with the arrow, is moving into that space. That's just the way human bodies work. It's a fancy term called mesial drift. And you can see that the tooth underneath is crowded out. It cannot get in there. You can see where the baby tooth in front of it is resorbing and it's starting to get loose, and that adult tooth underneath is going to come in pretty fine. And you can see the other one, the one that's near the center, is going to be crowded out. But here's the deal, is erupting teeth are very powerful, and they will erupt wherever they can. And this slide shows us how that happens. Looking at the rest of this slide, you see a pretty nice rounded arch, or at least in the dentist. But you can also see where they had a problem with premature tooth loss, and one of their premolars came inside the palate of that mouth. Well, a couple of things happened. That is very, very difficult to keep clean, very difficult, rather impossible to keep clean, and it has absolutely no function whatsoever. So they end up losing that tooth. We don't want that. So what can we do about premature tooth loss? Is keep the teeth. I know that seems very, very snipey and cutesy and stuff, but that's a powerful phrase, is trying to keep those baby teeth as long as we can until they naturally come out. So how do we keep the teeth? Well, early entry into the dental care system is the key. Get them into the dentist as quickly as possible before problems arise. So how do we do that? Oral health awareness. Oral health awareness is so important, not just for a mommy, but it's important for everybody that encounters the early child, the parent, the early child, the young child, the family as a general, and usually it's even, when I say the family, I'm really kind of thinking about, aunts, uncles, grandparents, and sometimes it's older siblings that actually will help direct family values for oral health awareness. Caregivers, that includes babysitters and neighbors and people like that. Teachers and assistants to try to be more oral health aware. That's who I believe are a lot of the people on this particular conference call. And believe it or not, policymakers. We have to make our policymakers aware of how important baby teeth are. You know what? They pretty much listened over the past few years about that, so we've done pretty well as far as doing that. That can always be better, and we work hard to do that. And that's one of the things that Lacey will talk about later is this, how do we keep the teeth through oral health awareness increase of our policymakers. So when we really think about how we can increase oral health awareness, we cannot have actual oral health awareness until we improve our own oral health literacy. And that's at a bunch of different levels. We need to have the patient improve their own. The parent or the legal guardian needs to improve their oral health literacy to make decisions for the people that they are responsible for. The caregivers that we talked about earlier, the teachers and the assistants, which is, once again, the target of a lot of the audience on this webinar. And once again, we have to increase the oral health literacy of our policymakers in order for them to understand, in order to make appropriate decisions regarding policies that impact oral health status in our state. Now, here's another, two more that I'd like to add to this list. We need to improve the oral health literacy of dentists and physicians just as well as everybody else. They're a huge part of this equation, and if their oral health literacy is not effective, the message isn't going to be heard. So let's talk about what oral health literacy is. And we've heard health literacy is such a buzzword, and to me, it's overdue being a buzzword. So let's talk about exactly what oral health literacy is. What is it? I stole this from the Healthy People 2020 document. Oral health literacy has been defined as the degree to which individuals have the capacity to obtain, to process, and to understand basic oral health information and services needed to make appropriate health decisions and act on them. They have to understand what the problem is. They have to understand what their options are to solve the problem, and they have to have the services around them to be able to act on those decisions. Now, we talked about policymakers and dentists and physicians, and I kind of think about them as being messengers. And I modified the Healthy People 2010 definition of oral health literacy to address the messenger. So I'm going to go over this really kind of quickly just to point out the difference. Oral health literacy for messengers can be seen as the degree to which individuals have the capacity to organize, convey, and make understandable basic oral health information and services that consumers need to make appropriate decisions and act on them. If a dentist comes to a mommy of a 6-year-old and says, you know, I believe that little Julie has a right incipient lesion on the mesial occlusal of number 30, and I think that we need to plan some treatment for that. The mom doesn't hear a whole lot. But if you sit there and say, you know what, that 6-year molar on the lower right, I think we got some decay we need to go ahead and take care of. So you've got to package the message so that the ultimate end user, the decision maker, can make a well-informed decision and feel comfortable with it. So good oral health literacy on both ends of the message results in improved oral health knowledge. It increases early entry into the dental care system, meaning that they have an established relationship with the dentist, thus creating the dental home. Public health programs are popping up all over the state that can incorporate early entry into the dental care system. And that's a whole other webinar if you want that for later use. Physician services. Physicians can make effective messaging to parents and legal guardians because they are more and more doing oral assessments, and they can look at a mouth going, whoa, Julie looks like she's got some holes in that little mouth of hers. We need to refer her to a dentist. And a parent listens to a physician. That's quite a role model for them in making decisions for their children. And there are other programs that move the child into care, and there are probably 11 different ones in Kentucky that also have the opportunity to move a child into a dental home, and that's good. So good oral health literacy on both ends of the message also results in lower decay. Boy, wouldn't that be great, lower decay. And what happens with lower decay is that ultimately results in more pain-free days of learning, regardless of the child's environment, whether they're in a home, in daycare, in your Head Starts, in early childhood development centers, in schools. Because we start learning the day we're born. And we learn tons our first 3 years on this green earth. So the more we can have a pain-free day, because kids in pain cannot learn, better for all of us. So it also results in better overall health for the rest of your life based on health status during their formative years. Also results in earlier learning, that when you have a pain-free mouth, you have permanent learning earlier in the lifespan. And when you do that, you have longer learning because you've started earlier, and you tend to learn longer, and you tend to go to school longer. When you start learning early, and we all know that. This is, I'm singing to the choir here on that. And then when you have longer learning, you get a better job, and when you have a better job, you pay more taxes. And we'd like for our society in general to become more taxpayers instead of tax users. So by looking at lowering decay of our very, very young citizens, we increase our economic status and economic sustainability of the state. And that's why baby teeth are important. So I'm going to turn it over to Lacey McNeil. And she is from Kentucky Youth Advocates, but she is also working and a leader in the Kentucky Oral Health Coalition, which is kind of new but quite established, and she's going to talk about what's going on with that.
Hey, thank you, Dr. McKee. And I guess I just take over as presenter from this point in time. So hi, everyone. I hope you're not multitasking. I hope you've learned a lot from Dr. McKee. Very complimentary to what I'm going to share in my part of the webinar. And I just want a couple reminders. I put over in the chat box, we are going to be tweeting during this webinar. So if anyone has Twitter and wants to check out and use that hashtag, Kentucky KY Smile Team, that would be great. And the reason we're doing that is to boost the oral health literacy across the state, as Dr. McKee mentioned earlier. I see a lot of familiar names over in the attendees box, and that's really exciting. And I also see a lot of area codes from around the state, which is great, too, to see a really nice representation from all across the state. So I'm going to go ahead and get started here. And what I'm going to talk about, the outcomes I'm looking to share with you all are a shared appreciation of the importance of children's oral health, and I think Dr. McKee laid that out quite nicely. And I wanted to make sure you all have a clear understanding about what your role is as early childhood professionals and health professionals in improving oral health. And I think we could probably learn a lot from all the other people on the call, too, so hopefully we'll get a chance to share some of the work that you all are doing. I also want to impart some of the relevant tools, resources, and initiatives in Kentucky that are going on that will improve children's oral health. I love this quote by Wayne Gretzky: "Most people skate to where the puck is. I skate to where the puck is going." And I feel like that's kind of what we want to do with this oral health in Kentucky, is kind of anticipate what we need and go there. When we think about oral health in Kentucky, these are some of the things that we want to see. We want to see that all children in Kentucky are healthy, that children have better access to dentists and hygienists and education and literacy and awareness about oral health. We really want to see children being surrounded by adults who know about the importance of oral health. And we would like to see a networked and connected system of oral health advocates, professionals, and others in Kentucky so we can all work together to have a stronger voice. And that's what the Kentucky Oral Health Coalition and its members are doing, but we'll get way more into that a little bit later. Just to better introduce myself, I work with Kentucky Youth Advocates, which is a statewide child advocacy organization. It's been around for about 40 years. A lot of you may have heard of the Kids Count book. It's kind of our thing that we're best known for. I personally have been at KYA for about 13 years and am working on the Kentucky Oral Health Coalition right now, as well as working on some obesity issues. So we did a lot of planning last year for what we're going to be working on in the next couple of years, and we asked our stakeholders to share one word or phrase that describes their vision for the future of oral health in Kentucky. And some of you on the call were at the meeting where we had this conversation. And I just wanted to share briefly what I think we had about 40 people in the room. And here's just some of the things that people brought up, and I just kind of found them to be very inspiring. So I look at them regularly to make sure we're on the right track. You can see words like inclusive, brighter, innovation, sparkling, everyone. I just thought this is kind of a good guidepost for us as people who care about children and families in Kentucky in general. It's kind of where we're going. So really briefly, I'm going to talk about the oral health need, and Dr. McKee talked a lot about kind of the micro, so on the individual level. I'll be talking more about like the state level and the needs there. Sorry, this picture is hard to look at for me, but I saw it and I just kind of wanted to show folks that this is a decayed baby tooth that never got treatment, and it's a permanent molar. It's already decayed. And so this is kind of why I do what I do. I don't think a child should have to live with pain that they don't even, they don't know that maybe they are in pain. It's just the way they've lived their whole lives. So this is kind of what I do, the reason I do what I do. So sorry, it's a little graphic, but this is a child's mouth. And I think a lot of folks on the call, this is not a surprising picture because they see this every day. This is what we're trying to prevent. So what prevents Kentuckians from having healthy mouths? What prevents that child's mouth that I just showed from being healthy? As Dr. McKee said, we're the third highest rate in the nation for toothlessness. This slide just shows kind of generically what are some of the issues we're having to deal with in Kentucky, and I'm sure these are not surprising to a lot of you all, that lack of transportation to dentists. We've heard about some counties in the state not even having a dentist in the county. So it goes into the geography, the cost. A lot of folks who are eligible for Medicaid and K-CHIP may not be maybe utilizing that. Or even if they are utilizing oral health insurance and other coverage, it still can be extremely expensive to get treatment. A lot of times office hours of dentists prohibit low-income workers from being able to get to the office during work time. As Dr. McKee mentioned, placing a priority on oral health. That's something that we are really trying to build up in the state, and we need to ensure that folks do understand the importance of taking care of their mouth and really value it. And then also the number of dentists across the state. It's my understanding we do have, an adequate number of dentists per person in the state, but a lot of those dentists don't regularly see a lot of lower income families. And there's a lot of reasons for that. Dentists cite that there's a very high no-show rate with some populations, and since there's not a huge value placed on oral health, there's not a lot of follow-up and treatment. So these are some of the things that make it difficult for Kentuckians to get oral health. This next slide shows the rate of general and pediatric dentists by region in Kentucky. You can kind of pick out where you live and see how many dentists there are per 10,000 people. In Louisville, we have, where I'm based, the problem here is, which dentist to go to. In the Appalachian region, it's kind of like, I need to find one. The only dentist in town only takes a certain amount of people, and he's not seeing anyone for a while. So something we're trying to work on is to get more dentists and more dentists to see families on Medicaid. This slide shows a decrease in the number of kids who do have K-CHIP or Medicaid who actually receive the service. So when children are enrolled in Medicaid and K-CHIP, they have access to certain services, dental services, which is excellent. We really like that. It's a great thing. And you can kind of see we started going up in 2010. I think it was the highest rate recently. 57% of kids who are on Medicaid and K-CHIP actually had a dental service. And then it started going down again. And so even though you have this coverage, does not mean you actually get the treatment or that you seek the treatment. So we wanted to go and talk to parents too. We looked at all this data and facts and figures and stuff, but we wanted to talk to parents about what they thought could help this problem in Kentucky. And we really found that parents knew about the importance of brushing teeth, but something was blocking them from actually doing it. There seems to be a lot of activities around the state, and I know there is. I've talked to so many people who are doing amazing work around the state. I feel like, if it can be a little bit more coordinated, that could be a very helpful thing. Schools are absolutely critical in child care centers in delivering education about oral health to parents and children. A lot of times, this is the only place where kids can get care. We also found that parents get a lot of their information from other parents, from their friends, from their parents. So that's why we think it's critical to try to, surround the kids with folks that know the right things and know what to do. So as Pat Schroeder says, you can't wring your hands and roll up your sleeves at the same time. So I know a lot of this seems a little bit daunting, but we have a lot of things we're going to share with you today that you can do in your center and in your community to mitigate some of these poor outcomes. So is anything being done to improve oral health in Kentucky? And I've said, yes, there's a lot being done. A lot of people on the call are doing amazing things in their local areas. So I'm just going to kind of briefly go over some work that the Kentucky Oral Health Coalition is working on, and then share some tangible resources that you can put to use in your center and your community. The first thing is, well, it looks like this got cut off a little bit, but I don't know if folks have heard about the governor's Kentucky Health Now initiative. You may have seen the logo on Dr. McKee's slides earlier. The governor has really made a huge priority to improve health in Kentucky, and he has several domains that he's identified as priorities. The one I'm highlighting here on the screen is the oral health priority, which I know a lot of folks are thrilled that that was even included, because a lot of times people don't think about oral health as an important thing to consider. So we thought that was great. You can check out their website and see kind of some more of the specifics about what they're trying to do, but basically they'd like to see more kids getting to the dentist. They'd like to increase public-private partnerships to reach more kids at school, and also would like to work with the managed care organizations in Kentucky to encourage better treatment. So that's an interesting way to get involved, and I think it just shows, that oral health is, getting more priority in the state. The next thing is the Kentucky Oral Health Coalition, which our mission is to improve the oral health of all people in Kentucky, and we're doing that with the following goals that are on the screen. We're trying to, communicate, collaborate, convene, and promote positive messages. Right now, we have about 65, 70 members in our coalition. And here's a great group picture. It's a little bit squeezed, but it kind of just shows a picture of us at our last annual meeting. And it's a very diverse membership, so we hope everyone on the call goes to our website and joins with us. We have dentists, hygienists, family resource officer centers, managed care companies, corporations, government entities, parents, community health workers, public health departments, social workers. You can see this group is a wide range of different people around the state. So we really would love to have you working with us, and I'll show our website in a little bit. This is a piece we put together last year. We have 2 work groups that actually we have 3 work groups now that are working to prioritize and strategize how to improve oral health in Kentucky. One is to improve access in Medicaid. One is to improve oral health literacy, and one is to get more school-based services, improve school-based work. Linda Pointer is on the call today. I saw her name, and she is in Northern Kentucky. She chairs our school-based work group. This is an article we put out last year for schools about how they could best select a school-based oral health program. So that's on our website as well if you would like to look at that. I think our biggest challenge that we're trying to do is to weave together all these wonderful individual efforts all across the state into a coordinated system of care in Kentucky. I think there's so many resources and passionate folks out there that if we could unite together, I think it'd be great. And I already kind of went over our priorities there. This is also part of a national network. So you can see from the map, there's about 36 states that have statewide coalitions. It's part of the Oral Health 2014 effort with the DentaQuest Foundation. So we are specifically working with our Southeast partners to create a regional network to improve services all across the South. One of our main goals that we hope that you will get involved with is reaching 3 Ps: parents, health professionals, and policymakers. And I'll talk a little bit more about those 3 in just a second. So here's different ways to get involved. Become a member and sponsor an event. Like us on Facebook. Follow us on Twitter. I think I've been seeing my phone light up here with all the Twitter stuff going on. And check out our website. Now here's some other specific ways that you can get involved. We have some wonderful partners up in Northern Kentucky that have a regional coalition called Healthy Smiles for Our Kids. They recently put on a wonderful conference up in Northern Kentucky, and they've done some great work to get the word out up there. And I just loved their slide, the asks of early childhood professionals with oral health. Distribute oral health materials, and I'll show you a picture of all the stuff they have to offer you all on the call in a moment. Make sure that every child over the age of 2 has a dental home. Dr. McKee mentioned the importance of a dental home. It's great to have school-based services and things like that, but we also want to encourage kids to have a place where they can go for all of their dental needs. It's a dental home. It's generally a dentist's office. But we also know that, while it's important to go to the dentist, that's 2 hours out of an entire year. There's 8,750 some other hours of the year where folks need to be doing positive prevention at home and at school. We also would like for early childhood professionals to promote an annual visit to the dentist. And you can talk to parents about that and talk to kids about it too in the classroom. So they have some wonderful materials, and you can see where to get those materials here. We distributed a lot of these at the Ready Kids Conference, and hopefully the folks that got those have been putting them to good use. You can see there's a parent's guide, and it's a guide for parents, and then there's a brochure, and this YouTube video down here about the Baby Teeth Matter is an excellent video. I learned a lot by watching it, so that could be something that you share with parents, watch as a staff together at your staff meeting, that sort of thing. And then they also have these magnets over here for parents to put on their fridge that talks about a lot of oral health literacy. And I recently found the American Academy of Pediatric Dentists. They have a 2-page handout with selected recommendations for child care specifically, which I thought was excellent. And there's the link. You can go check these out. But I wanted to include a few on the slide today just to share with you all. They too talk about promoting the concept of a dental home. And they want to make sure they're educating not only the parents, but their personnel about how to talk to parents about this. And they recommend that 1 year that kids start going to the dentist. They talk about sponsoring on-site, age-appropriate oral health education programs for kids. And this can include all sorts of topics, how to take care of your teeth, how to eat right, how to prevent injuries, and why going to the dentist regularly is important. And for each one of these bullets, there are so many resources, free resources available to you all as educators. If you all need any help locating that, please get in touch with Dr. McKee or the Oral Health Coalition, and we can help you find some great resources. What I'm finding is we don't really need to recreate anything. There's a lot of great stuff that's already out there. Provided in-service training for personnel on all the topics we talked about. There's a lot of ways that you can integrate this into your classroom. And I'm sure a lot of you all are doing a lot of these things. It'd be great to somehow share with each other what worked, what didn't work, what resources you utilize, what curriculums or activities that you could possibly share with your colleagues. Another one is to incorporate an oral health assessment as part of your daily health check of a kid. So making sure that, when children come in that they're, that they may be suffering from oral health pain that could be a part of why they're not participating that day. Or I think also when kids enter into your facility and when you have them turn in their immunizations and their other records, maybe you could encourage that they also get a dental screening or dental exam, ideally. And this one I thought was really interesting, that not permitting infants and toddlers to have bottles or sippy cups. Kids should not be carrying around bottles or sippy cups all day long. I don't even think, Dr. McKee, you might chime in, but I don't even know if having water all day long in a sippy cup is ideal. But certainly, just being aware of what's in the bottles or the sippy cups all day long at school is really critical. So something that we are going to be hosting this fall is a Train the Trainer session, November 6th, with the Healthcare Institute, National Center on Health, and the Head Start Collaborative. They have a proven program of training early childhood professionals to talk to parents and engage parents on oral health. And we're bringing them to Kentucky. We're going to be selecting 7 teams of 3 people from all across the state, so 7 teams of 3 people each, all across the state who are going to commit to improve oral health literacy. And so we're wanting to train as many parents as possible on all of the stuff we've been talking about today. And we think that if we can, really target in on a community, a learning community, that folks can, get better at this together and work on this together. So if you are interested in this, we're kind of recruiting folks right now. So please get in touch with me afterwards as we move forward with planning this. And that is all I have to share today. Dr. McKee, I don't know if you wanted to highlight anything else or add anything else to what I said there in my part. And we can't hear you if you are talking.
Well, it would help if I didn't have my mute button activated, wouldn't it? I would like to, let's go back to the sippy cup business, is I personally don't, nor professionally, like sippy cups. But actually, believe it or not, if the sippy cup was filled with fluoridated water, I'm all over that because it keeps the mouth moist, and moist mouths don't decay, and it's got constant fluoride application to those teeth to make them even stronger. But the minute you put in the Mountain Dew and the Coca-Cola and the orange juice that they sip on all day, then we get into problems. But fluoridated water, have at it, baby.
Good. Okay. Well, that's pretty much all I had, Amanda. I don't know if you wanted to open it up for questions or.
Yeah, absolutely. I've been kind of keeping track of the chat box over there. I've seen, for those of you that are interested in getting some of those resources that Lacey talked about from Children's Inc., just shoot me an email, and we'll make sure that we get that up to them and figure out the best way to get those resources into the hands of the CECCs. It does look like we do have a couple of folks typing, so I'll hold on just one second and see what their questions are. But let me go ahead and say thank you guys so much for coming and talking to us today about the importance of oral health in the state. As Lacey mentioned, one of the governor's main focuses right now is that Kentucky Health Now agenda that he has put together to reduce children with oral health decay by 25% by 2019. So I do think that it's important to keep that in mind as we move forward over the course of the next few years, writing our grants, thinking about different activities to be done, and that sort of thing. What is Dr. McKee's opinion on breastfeeding at bedtime after the age of 1?
I am a breastfeeding proponent. I think that it does good things above and beyond the absolute perfect nutrition that it gives a child. Here's the deal. It's just like any other meal, is that after a meal is made before you go to bed, you clean your teeth. So, if you're going to breastfeed for as long as it takes, the end activity of that breastfeeding needs to be cleaning the mouth, because you still have those milk sugars that could last all night, and those milk sugars start wearing on those teeth, actually. So it's just like any other meal. You clean the mouth after the meal before you go to bed.
All right. Anybody else have any questions for Dr. McKee or Lacey? All right. Well, we will get some more questions, I'm sure, after I get some email questions after this is over. So I will make sure to send those right on to Dr. McKee and Lacey. And I don't know if you saw my face in that picture of the Kentucky Oral Health Coalition, but I was definitely there, standing proudly. So, as we usually do, give you guys a few updates and announcements that we want to make sure that you know about. You have to make sure you get those parent guide orders in by tomorrow if you want to if you want to be a part of this next wave of printing those parent guides. We do have the website right there. It's kidsnow.ky.gov is where you can go and place your order. So just make sure you get that done by close of business tomorrow. There was a little bit of confusion about the annual reports this year. They are due on August 29th, not August 15th, which I think is what the form says, but they are due August 29th. So I know that we've received a lot of those over the course of the last little bit, but we just want to make sure we get those in. As for the next webinar, it'll be Thursday, September 11th at 2. We were going to talk about obesity prevention and early childhood programs, but I just got word about 5 minutes before we started the webinar today that is not going to be the case. I'm not going to be able to work schedules out on that. So keep your eye out on what our next webinar is going to be. And then finally, the governor did announce some grants that went out to local health departments to provide a dental hygienist and assistant to health departments on the local area to help with the initiative of reducing children with oral health decay by 25%. So that link that you see there goes directly to his YouTube announcement about those grants that went out. And, you know, as usual, we definitely suggest reaching out to your local health department to see what you can do to help provide some of that, some more parents and families to that program. So keep that in mind, and you can also Google Kentucky Health Now, and you'll be able to see all of the goals that the governor has set forth to achieve by 2019, including obesity prevention and oral health. So again, thank you guys so much for taking time this afternoon to join us on the webinar, and thank you, Dr. McKee and Lacey, for joining us and teaching us a little bit more about how important it is.
Thank you so much.
Thanks. Thank you. Bye, everybody.
Thank you.
Bye.